Canada has now phased out most of its COVID-19 restrictions. All the provinces have lifted their vaccine mandates. Every province except Quebec has dropped mandatory public masking. And it's all part of learning to live with COVID, we've been told. But the only remaining indicators of infection rates, wastewater testing, is now showing rises so rapid in some jurisdictions, like Ontario, that public health authorities are now talking about a new wave of COVID-19. Joining me now is Dr. Christopher Labos. He's in Montreal. Dr. Labos, thanks for taking the time.
My pleasure.
I want to ask you, what are you watching for? I mentioned that hospitalizations are going up again. I saw the figures in Ontario, they're going up again. In Quebec, I believe they are too?
Yes, exactly. I mean, for the past 2 days, we've had cases over 2,000, and that's with very limited PCR testing. We're no longer having PCR testing for the general population. So even within that limited framework, we're seeing an increase in cases. We've seen hospitalizations level out and start to go up again as well. So same sort of indicators here in Quebec suggesting that we're entering the beginning of a sixth wave.
So what do you make of it?
I think we're seeing a confluence of factors coming together. It's the introduction of the BA2 variant, which is more infectious into this country. We're seeing the surge of cases that was going to happen when we start lifting restrictions, and we're seeing a few other factors play into it as well. The fact that the vaccine effort has largely stalled, and that people are being a little bit complacent about COVID these days.
It's worth mentioning that Quebec is still not lifted its public masking regulations. I think that's in mid-April, but you're the only jurisdiction where they haven't lifted the public masking regulations.
That's right.
Thoughts on that?
Well, I think we're going to have to rethink that. I think, here's the thing, we've demonstrated, COVID has not gone away. There's still a lot of COVID out there. So if you're going to be in an indoor public setting with a bunch of other people breathing the same air, I think there's a strong benefit to wearing a mask in that type of situation, because this is a respiratory virus. This is how it spreads. So we have to be mindful of that reality and realize that in certain specific situations, wearing a mask probably has a huge benefit and frankly has no real downside. It costs virtually nothing. It's not dangerous. It's not harmful. It's mildly uncomfortable around your ears. But apart from that, there's no real downside to wearing a mask.
And yet there seems to be this public groundswell saying, yes, but we don't want it to be required. We're through, you've heard all the refrain. We've had it with COVID and all that, but we don't want it to be mandatory. We don't want it to be required. Here in Ontario, just 1 week in, you go into a supermarket, it's interesting, and you'll see half the cashiers wearing masks, the other half not wearing masks. You think that's something that might be worth revisiting?
Here's the thing. People look to the public health department for guidance. I mean, we don't take this approach when it comes to seatbelt laws or to, wearing bicycle helmets. There was a time when the public health and the government's role was to tell people, what's necessary. So I think wearing masks in specific situations is frankly necessary. So I understand that people don't want to be told what to do, but not doing this thing is dangerous. I mean, more people will get sick, more people will end up in hospital. So my response to that is, like, if people don't want to be told what to do, that's fine, but do what is necessary, because the alternative is just the healthcare system that gets overwhelmed again if this wave ends up being worse than all previous waves.
Okay, some short snapper questions, as they say. The subvariant, the BA2 subvariant of Omicron, what do we know about it? I mean, it's being now called the most prevalent strain in many provinces. What do we know about it in terms of its seriousness, its effects?
Yeah, well, we don't know much because we don't have a wealth of data. It's probably very similar to BA1, the original Omicron strain, in terms of its severity. It is a little bit more infectious. Vaccine efficacy seems to be the same against it. So the real question is going to be, do people get reinfected who got Omicron a couple of months back? If people get reinfected, then we might have a problem. If people don't get reinfected, then we might be reasonably well protected.
You mentioned something too, and I was going to bring it up, and that is vaccination in Ontario. The overall figure is only 50% of Ontarians around that got their third dose or their booster dose. It's very high in certain age groups, above 60, but for the rest, forget it. Has vaccination, I think you said, it's fallen off the cliff. Is vaccination now a thing of the past because of all the signaling that people are getting by all the public health measures being lifted?
Well, I certainly hope not. I mean, when you see anybody say that we have to whenever somebody says we need to lift restrictions and learn to live with COVID, the caveat to that is, because our vaccination rate is so high. Our vaccination rate is not that high. And, immunity wanes with time. A lot of people are sort of banking on the fact that because so many people caught the Omicron variant, they're going to have some post-infectious immunity, which is fine, but people have gotten reinfected. And as new variants emerge, if they're more and more different, that post-infectious immunity may not protect you as much as people think they do. So I think there's going to be a big advantage to really encouraging people to go out and get their third dose as time passes, because that's what's going to protect us. If we let that fall off a cliff, we might be in trouble in the future.
So vaccination as a way of life, in a way.
Well, here's the thing. I mean, vaccination has always been a way of life. I mean, you're supposed to get a flu vaccine every year. You're supposed to get a tetanus shot every 10 years. There is, we tend to think of vaccines as childhood things, but there are stuff that you should be getting throughout adulthood as well. So it's just it's a recognition that we need to do these things. Vaccines make people healthier. They don't make people sicker. We just have to start thinking of them that way.
Okay, some provinces have removed, I was going to say confinement, that's the French for it, but some provinces have removed all self-isolation requirements for people who are infected. Thoughts on that?
So don't be that guy who shows up to work sick and infects everybody in the office, right? If you're sick, stay home. I mean, just the very basics of that should be self-evident, right? If you're sick, whether it's from COVID, the flu, or the cold, or any other virus, don't go out and infect people. Nobody is so important that they have to show up to the office. And I think what's the pandemic has shown us is that a lot of people can work from home and work remotely. So when you're sick, stay home until you're no longer infectious. That is just basic concern for your fellow human beings. So show that concern for others and stay home, because even if the government doesn't force you to, there's a good reason to not go out and infect other people.
Okay, last question. If, as we are seeing, there is some degree of rising infection rates as limits and requirements and measures are lifted, is it going to be easy politically, in terms of public opinion and logistically, to reinstitute measures if we get into trouble?
Well, that remains to be seen. Maybe not. We have certain, you can't on the one hand tell people, oh, things are getting better, we can lift all restrictions, it's great, and then the next week say, well, things are not that great anymore. There's going to be a lot of pushback. I think if people see hospitalizations filling up again, I think the point will become made, but it's going to be very hard to implement these measures early and prevent that from happening. And if we simply wait for the healthcare system to become overwhelmed, well, we may have waited too long, unfortunately.
Okay, well, something tells me this won't be the last conversation we have on this issue. Thank you very much, Dr. Labos.
My pleasure. You take care.